patient should be sitting on the table. The examiner then asks the patient to blow a balloon without opening their mouth. So if you're looking for increased pain due to increased intrathecal pressure, which may be secondary to space-occupying lesion, herniated discs, tumor, or osteophyte in the cervical canal, which is a positive finding.
For the stoop test, the patient walks briskly for about 1 minute, and the examiner is looking for the patient to kind of forward flex at the trunk. This would indicate pain, and the pain is relieved when the patient does forward flex. There would be pain in the butt or the lower limb area brought on by the brisk walking, and you'll see that forward flexing at the trunk. For the kernig or Brudzinski signs, the subject is going to lie supine with his hands cupped behind the head, and the examiner is going to stand next to the subject and watch. They're instructed to flex the cervical spine by lifting their head, interlocking their fingers right behind the head. The hip is unilaterally flexed no more than 90 degrees by the patient, and the patient also flexes the knee no more than 90 degrees. And you're just going to leave the other leg straight on the table. The test is confirmed by increased pain with neck and hip flexion, and then the pain is going to be relieved when the knee is slightly flexed.
For the 90-90 straight leg raise test, the patient lies supine, stabilizing both hips at 90 degrees, flexing the knees at both hands. The knees are bent in a relaxed position, and then the examiner tells the patient to lift one knee up one at a time, and then both at a time to compare how much flexion the knee has. And you're looking for tight hamstrings if they are if the knee is flexed greater than 20 degrees. This is the bowstring test, also known as the cram test. The examiner performs a passive straight leg raise on the involved side. If the subject reports radiating pain with the straight leg raise, the examiner then flexes the subject's knee to approximately 20 degrees in an attempt to reduce painful symptoms. Then the examiner applies pressure to the popliteal area in an attempt to reproduce the radicular pain. Painful in the radicular reproduction following popliteal compression indicates tensions on the sciatic nerves. You have the patient lying supine with both hips and knees extended. The examiner is then standing distal, has the distal hand around the subject's heel and the proximal hand on the subject's distal thigh anteriorly to maintain knee extension. Examiner slowly raises the test leg until pain or tightness is noted. You want to make sure the patient is relaxed. The examiner then lowers the leg until pain or tightness resolves, then dorsiflexes the ankle and instructs the subject to flex the neck. Pain in the leg or low back occurring with dorsiflexion or neck flexion is indicative for dural involvement.
For the Wells straight leg raise test, the patient is going to lie supine on the table. The examiner places one hand on the anterior aspect of the uninvolved leg, and it's going to be slightly superior to the knee, and the other hand is going to be around the ankle of the ipsilateral calcaneus. And then the examiner is going to passively flex the subject's uninvolved hip while maintaining the knee in an extended position. If there's a complaint of pain on the involved side, it can indicate a positive test, and it could be related to vertebral disc damage.
So this is the slump test. You're going to have the patient go in a slump position, then you're going to flex the neck, and while flexing the neck, you're going to extend your knee and then dorsiflex the foot, and you should be looking for a sciatic type pain.
So for the Thomas test, the patient puts their butt on the edge of the table, they grab one of their legs, and they just fall back on the table. So this shows slightly tight hip flexion. And then we move on and we can see an example of very tight quads. And now we can see an example of a very tight IT band, looking at the left leg.
So this is the Trendelenburg test, and the patient would stand on one leg, and you are to look for hip stabilization. If the hips do not drop, then it is a negative test. But when you do see the hip drop on one side on the involved leg, it's probably because he has weak glute medius.
So for the Stork standing test, the subject is going to stand on one leg with the sole of the non-weight-bearing foot resting on the medial aspect of the knee of the weight-bearing limb, and then the subject is going to maintain their balance while they slowly lean back into lumbar extension, and the test examiner should be standing behind the subject and just watching them to make sure that they don't fall backwards, and you're looking for any pain in the lumbar region.